The Medical Escort program at Dixon Hall Neighborhood Services is designed to provide companionship, language translation, and moderate physical support to a senior attending medical appointments. Volunteers are key to the Medical Escort program. Without you making time available to help a senior, there would be many people unable to safely access the medical care they need to lead healthy and productive lives. As a Medical Escort volunteer, you are doing more than escorting someone. You are providing companionship, a reassuring word, and confidence to an isolated senior. Volunteers fill two major roles: Medical Escort volunteers and Korean-speaking Medical Escort volunteers. Medical Escort volunteers tend to provide more physical support to clients, while Korean-speaking medical escorts provide translation services for clients when meeting with healthcare professionals. Volunteers must be able to commit a minimum of 4 hours to a single escort request. All volunteers must have a good command of written and verbal English, and a familiarity with medical terms is required. Clients make their requests for support with staff a minimum of 3 business days before their appointment. The requests are sent out to the volunteer pool, usually via email. Requests will include information such as client address, appointment location and time, expected length of appointment, and method of transportation. Volunteers advise the program coordinator if they're available to assist the client. Once confirmed, you will receive the medical referral form, which includes information about the appointment, transportation arrangements, and any special instructions to help you properly support the client. On a typical escort call, the volunteer meets the clients either at their home or at the doctor's office. Introduce yourself and show the client and the medical staff your ID card. If traveling with the client to the appointment, provide light physical assistance if necessary, such as helping them into the car, providing a steady hand on stairs, or offering to carry items such as bags, especially if the client is using a cane or walker. Engage the client in conversation when waiting for their appointment. If providing language translation, advise the medical staff of your role in supporting the client during the appointment. Be sure to review with the client any instructions given by the medical staff and help the client book a return appointment if necessary. Your support may be needed after the appointment itself to accompany the client to the pharmacy to fill prescriptions or to attend a lab to have tests done. Each medical escort volunteer is provided with a cell phone, two-way radio, and a list of staff contact numbers. Ensure that you know how to use the two-way radio feature of the phone to reach a staff member immediately in case of an emergency with the client. In the folder with the phone is a first aid kit for minor cuts or scrapes. What to do in case of an emergency. If the client falls or is ill, do not touch the client as they may have a spinal cord injury or internal bleeding. Cover the client with a blanket or coat to prevent or delay shock. Call 911. Call the office or use the two-way radio feature. Staff will meet you at the hospital. Please stay with the client and advise EMS staff of medical information on referral form. When you return to the office, complete an incident report. Thank you for giving your time to volunteer with the Medical Escort program. You are asked to commit to be available for 1 escort shift per week. This will ensure that together we can help as many seniors as possible access the medical care they need. You are making a difference for another person. Thank you.